Hi, Jane.
Hello. Sorry, it wouldn't let me take myself off of mute until I acknowledged it was being recorded. I was wondering what was wrong. Oh, maybe I can blur my background. Hey, Mike.
Morning or after, oh, morning still. Yes.
Hello. Thank you so much for joining us for this.
Sure. Jane, I love that wall.
Thank you. I was actually just getting ready to blur my background.
um, that it reminds me of we went on vacation to Tennessee and stayed in a cabin,
Oh,
and
yeah.
the walls were like almost a glossy wood. It was incredible.
Oh, wow. Um, yeah, this is my cozy little Tahoe cabin.
Did
There we go.
you get any snow this weekend?
Yeah, I mean, down at lake level, it was kind of slushy, but higher elevations got some better quality snow. So yeah, I did a lot of skiing this weekend.
Nice. I went skiing once in my life, and that was in Sweden when I was stationed in Germany, and I spent the entire weekend in the lodge drinking beer.
Oh, sounds like a beautiful place to do either.
Yeah.
Ski or hang out and drink beer. Uh, yeah, I do both. I do cross country skiing, which I do with my dog, and like he pulls me. It's so fun. It's like called ski joring. But and then I also just downhill ski.
Oh, how fun, Jane.
Yeah. Well, he's a working dog and he doesn't have a job any other time of year. So I think he really gets excited when he's like, finally, I have a task. So yeah.
That's so cute.
Hmm. I was just gonna use Mike's bio that we used at the roundtable meeting.
Yes.
Alrighty. Oh yeah, let me make sure I can see Q&A and stuff. Okay, I see chat. Is that where the Q&A are? Or what we use for Q&A?
Yes, it is.
Yes.
Hi. Hi, Jane.
Hi,
Hi, Shantae.
Julie.
Hi, Julie.
So I'll start the recording like at noon.
Okay.
Can I please be made co-host so I can share my screen for the slide deck?
Yes, I would do that right now. It's actually recording right now, so I will chop this part off when I send it to you, Shantae.
Thank you.
I'll make you a co-host. Okay, Joyce, you should be able to share screen.
Julie, are we, you know what? I'll send you an email.
Okay.
Good afternoon, everyone. Thank you for joining the HPV Vaccination Learning Collaborative. We'll get started in just a second. In the meantime, go ahead and introduce yourself through the chat and include your name and your organization and your role. We're going to go ahead and get started. Good afternoon. My name is Shante Davis Patterson, and I am the Program Director for California's Comprehensive Cancer Control Program. We administer the State Cancer Coalition on Cancer, which is one of the co-founders of the California HPV Vaccination Roundtable. And we're very happy to bring you the HPV Vaccination Learning Collaborative. So happy New Year to everyone, and we're so happy you are joining us. Just some housekeeping. All participants have been muted. So to ask a question, please unmute yourself, and we will have a question and answer period at the end of our presentation, and of course, some sharing at the very end of the session as well. Feel free to drop any questions you have in the chat box as we go along and as our presenter is presenting. This webinar is being recorded, so it will be available soon on our website. I know we're kind of behind on having all of the recordings for these collaborative sessions on the website, but we will be having those on there soon, and I'll send out a note once we get all of that stuff up to date for everyone. And then, of course, evaluation. So at the end, we'll do evaluation, so please help us evaluate. So this is being brought to you by the Engaging Health Systems and Providers Work Group of the California HPV Vaccination Roundtable. And the roundtable, if I can have the next slide, please. The roundtable is a coalition of diverse stakeholders with a mission to work together to prevent HPV-associated cancers and precancers by increasing HPV vaccination rates. And our goal is 80% by 2026. And then you see our website there. So I wanted to do a quick, fun icebreaker. What 3 items would you bring with you on a deserted island? I don't think you need to put your name, organization, and role on there because we'll see whose response that is. But just take a minute and just think about what you would bring if, you know, if you were dropped somewhere in the middle of nowhere and you had nothing to survive. What are those items that you would bring? So, and I'll just kind of put mine in there. And I have to say that I am a fan of Naked and Afraid. So I'm going to be putting practical items in there. I know when I watch it, what you need to survive from my perspective. So I'm going to put in there a fire starter, a pot, which you have to boil water because you need water to survive, and a knife. All right. So just think about those, and we can look at them in the chat as we go. All right. So our agenda today, we're going to hear about the announcement approach trainings. We're going to be offering those. We will have an update on CAIR, the California Immunization Registry, and then at the end we'll have a Q&A period. All right, so for the announcement approach trainings, these are trainings that we've been offering for a few years now. They present strategies for recommending the HPV vaccine to promote vaccine acceptance and save clinical time. They're designed for providers interacting with parents. And it also, during the training, you can learn the latest on HPV vaccine research and guidelines, as well as brief evidence-based communication. This is a 1-hour online interactive training. And you just contact us if you want to have that training. I'm going to drop the flyer in. So if anybody is interested in having their one of our physicians, right now we have Dr. Irene Landau giving all of these presentations. You could just contact. I will get this in the chat soon, so you guys can have that information. You can also go on our website for info at there's an email that we have on our website as well. I promise I'll put all this information in the chat. Can you go back to that slide, please, Joyce? So with these announcement approach trainings, how it works is you just contact me, and then for whatever providers, we've done them for residents in the past, we're going to be looking to do that again. And if you want your team also to receive the training, they are designed for providers, but just contact me and we can talk about the audience, getting this set up. It is online, as I said, and it's also interactive. So it is a training that will require your participants to actually participate in the training instead of just sitting there watching it. And I also wanted to note, like a little bit later in the year, we're hoping to have some continuing medical education units for the training as well. Right now, we don't have them, but it's still a great training to have. And it really just outlines how you can best communicate with parents, dispel those myths. Yeah, so it's a good training. And again, I'm going to get all those details and drop them in the chat as we move forward. Okay. All right, so now I want to introduce our moderator for the session. That's going to be moderating the Q&A after our presenter. So, and it is Jane Gray, as you see. She's been a health educator with the California Department of Public Health Immunization Branch for 10 years. While she works on projects promoting immunizations for all ages, her focus is adolescent immunizations, including the HPV vaccine. And Jane is also one of our founding members that serves on our steering committee. Jane is on our data work group, has done a lot on that work group for the data piece on with the roundtable, and is just a great wealth of, she has great information and resources for us. But let me turn it over to Jane so she can introduce our presenter.
Great. Good afternoon, everybody. It's nice to see so many familiar names. Thank you for joining us today. And I'm happy to introduce our main speaker today, who's Mike Powell. He's the chief of the Registry and Assessment section at the Immunization Branch. He has been in information technology and IT management for over 25 years and with CDPH since 2010. Michael earned bachelor's degrees in business and information systems and a Master of Science degree in computer science with an emphasis on database development and administration. Michael and his wife, Sherry, live in the San Francisco Bay Area with their 3 children. Michael also enjoys sports and amateur radio. So thank you so much, Michael, for joining us today to give us this great presentation on the California Immunization Registry.
Thank you, Jane. And I did want to clarify that those 3 kids that I live with, they can move out anytime they want. They're old enough now. So just saying. Next slide, please. So when I talk about the California Immunization Registry, a lot of times we talk about numbers in the registry. And this slide depicts kind of where we are, or where we were in September. We have over 50 million patients in the registry, and as this slide is a little bit out of date, as of yesterday, I received new numbers, and we're at over 560 million doses in the registry now. And I'll talk a little bit more on a slide or two about why those numbers have gotten bigger, not just because of COVID, but because of some other things that we've done in the registry. Next slide, please. But to give you an idea of how we got to where we are, you need to kind of see where we were. And in 2014, the registry in California was really 10 immunization registries split into regions, as you can see on this map. The challenge in this model was that the regions, or the regional registries, did not speak to each other. So if you got a vaccination in San Francisco and then moved to San Diego and received a vaccination in San Diego wouldn't know of the vaccinations that you got in San Francisco through the registry. That would only be through your likely at the time hand-carried medical records, or some other method of getting your medical records from provider to provider. Next slide, please. And I'm sorry. I think that if you go back a slide, it's actually a transition in the slide. It should be, okay. I'm not sure what happened to the rest of my slides, but I'll tell you about it. In 2017, we did a migration where we migrated 7 of those 10 regions into a single region that we call CAIR 2. And when we did that, it created a model of more sharing throughout the state, where we could see those immunizations from region to region. But we still had independent regions of Imperial County, San Diego County, and San Joaquin Valley. And then in 2018, Imperial County migrated to CAIR 2. In 2022, San Diego migrated to CAIR 2. And then in November of 2022, San Joaquin and CAIR 2 and the state registry entered into a sharing agreement where we can see all of San Joaquin's doses in the registry, and vice versa. San Joaquin has access to all the doses in CAIR 2 as well. So essentially, we have a statewide immunization registry as of November of 2022, which is what the map in front of you depicts at the moment. Next slide, please. And when we talk about the fully integrated model of San Diego, we did migrate all of their data from 1990 until March of 2022 as part of that migration. And then, as I mentioned, with Healthy Futures Ride, or the San Joaquin Regional Registry, that went live in November, we have a regular synchronization schedule where every 30 minutes we're receiving the vaccinations that were administered into CAIR 2. Next slide, please. Another big event that happened last year, or technically, I guess it happened the year before last now, but went into effect last year, was the signing of AB 1797, which mandates that all vaccines administered in California be submitted to an immunization registry. This amends the Health and Safety Code that governs immunization registry data use, or HSC 120440. There are some other health and safety codes that have effect on the immunization registry, but this is the one that really governs data use. And it also adds required data elements that include race and ethnicity when submitting immunizations to the registry. And a little bit about that, although it requires the data elements, it doesn't mean you have to give your race and ethnicity. You can still choose not to disclose your race and ethnicity, but they still have to be included as data elements when it's sent to the registry. And just to be clear, this is not used for any kind of discrimination. This is really to help us better serve our communities and make sure that we're vaccinating everyone equally. Another area of AB 1797, it states that from January 1st, 2023 to January 1st of 2026, it allows schools and childcare to look up COVID-19 vaccination status for attendance purposes. There is a caveat to that in the law that says that the school's governing body has to require COVID to be required for school attendance before the registry can be used to verify that status. But that is part of the law, and that will be automatically repealed on January 1st, 2026. From a branch level, we do have teams put together to work on workflows, communications, and frequently asked questions, which there's a link to in this slide regarding AB 1797, where it's FAQs for both providers and for the public to kind of see what we're doing, answer some common questions, things of that nature. Next slide, please. Another big thing that we did was the digital vaccine record, which started as the digital COVID vaccine record. It went live in June of 2021, and at the time you could visit this website, myvaccinerecord.cdph.ca.gov, enter some identifiable information into the system that you would know and we would have on file. First name, last name, date of birth, and then either your email address that's on file or a phone number, a cell phone number that's on file. And then you would have a self-created personal identification number that you would create during this process. And if we find your record in the registry, it would send you a link back where you could download your QR code for your COVID vaccine record. And then that eventually migrated into the digital vaccine record, which I'll talk about in a minute. But to date, we've delivered over 20 million digital vaccine records. It is built on the Smart Health Card framework, which is a common framework used throughout the nation for digital information of health information. And it can be downloaded to Apple Health, Apple Wallet, Google Pay, and the CLEAR app, as well as Samsung Pay. And we're also working on a pilot with Google right now for their Google Health application to get the digital vaccine record into that format as well. Next slide, please. When you visit the site now, at the time, again, an initial release, it was the digital COVID vaccine record, but now it's the digital vaccine record. So when you visit the site now, you have an option to either request your digital COVID vaccine record, your digital vaccine record, or both. And the reason that we have the both is because they're technically still two separate processes. So you can get your QR code for COVID, but then you get a different experience for all vaccines. Next slide, please. And this is what the form looks like when you download your digital vaccine record as a paper form or a printable form. And it does have things on it like when your next dose is due or if you're overdue for a series. And that includes anything that's ACIP recommended. And we'll talk a little bit more about ACIP in a minute because that does have an effect on some of the things that we've done for HPV. Next slide, please. We also have a recommended vaccine section for vaccinations that a patient may not received any doses of that series. And this is just to tell them that you don't, in this instance, you don't have any doses of COVID, but you are recommended to have one. And then it'll have a relevant date. Of course, March 1st, 2023 is just an example. That's not relevant anymore. But this will list not just COVID vaccinations, but any vaccinations that fall into this category. Next slide, please. This is an example of what the mobile experience looks like. When you get your full vaccination record, now it will give you a screen. They'll show you the vaccine groups. And then if you click on the groups, it'll expand that group into the vaccines that you've received. This makes it a little more manageable, a little easier, and also shareable. If there's only a certain vaccine, if you want to prove to someone that, yes, I have my flu vaccine, you only have to show them the influenza group, not all of the vaccine groups. So you don't have to hand over your entire vaccination record if that's needed. This is compatible on, this is for all mobile devices. If you do this through your computer, you will get the full immunization record as I showed on the previous slide. Next slide, please. Our information education team has done a fabulous job of putting together marketing materials for us. This is a flyer that a lot of schools have used, and it's also available in multiple languages, promoting the digital vaccine record. This is really helpful, especially for school kids of school age, or when they're enrolling in school and they forgot to get their record from their doctor or something like that. They can literally stand in line, download their vaccination record. My lights just went out. I'm sorry. Gotta love energy efficient buildings. So the information education team has done a terrific job putting all these marketing materials together for us. And these are all available on our website. And the website is, it's available on myvaccinerecord.cdph.ca.gov and also at our on our easyiz.org website. Next slide, please. We have made some significant policy changes in addition to the changes of AB 1797, which you've already talked about. We also are requiring that every provider that submits an immunization to the registry have their own unique ID. This way, we know what providers are submitting doses or what providers may need some assistance in submitting doses. We've had in the past where, for example, a local health jurisdiction receives doses and then has people administer the doses on their behalf, but then records them under the local health jurisdiction. We want everybody, where we need everybody, to use their own provider ID. If they're the ones putting the shot in the arm, we need to know who that provider is. And we are also working on a lot of data quality issues. And one of those data quality issues is making sure that lot numbers provided by the manufacturer are entered into the registry exactly as they are given to us, or exactly as they are assigned. We have a lot of dirty data in the system with this, where they'll put in a lot number and then a hyphen and then something else. And sometimes that something else is VFC or state general fund, and does make sense, but it's not the lot number. Other times it's something that only the person who put it in would know what it means. And that's not helpful to anyone, well, except for that person. So we really need people to put the lot number in exactly as it is. This also comes into play when there's a recall and we need to recall or notify people of a recall on a specific lot number. Next slide, please. I want to talk a little bit about some of the changes we made to the HPV schedule in the system. And this is a screenshot of CAIR. And this is a test patient. There's no real data here. But the ACIP recommendation, there should be a transition slide. Can you hit the next slide and see? Okay, perfect. Thank you. So if a patient comes in that's 9 years old and they get vaccinated for HPV, the system will count that as a valid dose and then put the schedule in place. So it'll recommend the next dose, which you can see where the arrows are. You can see that the patient is 9 years old and that the next recommended HPV dose is in the bottom section. But currently, or before we made this change, if a patient came in at 9 years old and didn't have an HPV vaccination, it would say that it was recommended, but it recommended at 11, and it would be in that lower box that you see on the screen. Next slide. And then, I already talked about that. So that's just showing you that, yes, it does count it as a valid dose. So it'd be dose 1 of 2, and it recommends the next dose at the appropriate interval at 9 years old. Next slide. So the change that we made is that if a patient comes into the registry or comes into the provider's office and they're 9 years old and has not had an HPV vaccination, we have an alert now that shows that the patient is eligible for the vaccine at 9 years old. Now, even though it's not recommended at 9 years old, it's still recommended at 11, but it can be given at 9. And then if the doctor decides to give the immunization at 9 years old, then the same thing will happen again. It'll count it as a valid dose, and it'll enact the schedule into the system. And we wrote this in a way that it's not just applicable to HPV. We can apply that. We built the framework underneath so we can apply it to any vaccination that this may be a concern for. And what we're looking at right now is meningitis B. But this has been a good addition, and we've gotten a lot of positive feedback on this feature in the system. It's been out for a few months now. We have also had some feedback on how the dismiss alert works. And we're looking a little deeper into that, because right now, if a doctor looks at the alert and says that, yes, the patient's 9 years old and yes, they're eligible, but I'm not going to give it to him yet or her yet, depending on circumstances that could range from anything, they can dismiss the alert. And once they dismiss the alert goes away for that patient. We're looking now at, do we need to make it go away just by that provider for that patient? And these are some things that we're working with our medical officers on to kind of refine the process. But the cool thing is that because the framework's in place, we can really apply this to other vaccines and help get more kids vaccinated. And I believe that's it for me, Jane. My email address is here. If anybody does have additional questions after this meeting, you want to email me, feel free to. And with that, Jane, I'll turn it back over to you for Q&A.
Great, thank you so much, Michael. I'm looking in the meeting chat to see if there are any questions there. I don't see any there yet. I believe you can also unmute to ask a question if anybody has one. I know that this change has been a welcomed one by many providers. They were asking for it for a long time in terms of the forecasting for HPV vaccine. So it's great to know that that's part of the system now. Still don't see any questions. Trying to think if I have any. Since I'm an insider, I feel like I already know about it though.
I have a comment. I love that somebody put a coconut shucker as one of their 3 items on the.
Yes. Nice assumption that there would be coconut
Right.
trees. Yeah.
All right. Well, if we don't have any questions on the CAIR update, we can open it up for anyone who has any questions in general for the Learning Collaborative or the Roundtable, or if you have any updates within your organization that you want to share. This is a time where we can open it up and the floor is yours.
I may take this opportunity just to make sure that everybody on the call is aware of a campaign that we lead here at the Immunization Branch called Preteen Vaccine Week. We observe this every year, and it's scheduled to overlap with International HPV Awareness Day, which is on March 4th. So yeah, if you don't already know about the campaign, you're curious to get involved, because HPV vaccine promotion and education is a big part of that campaign, because of all adolescent immunizations that are offered around, between the ages of 9 and 12, HPV vaccine is the one that lags the most. So we have a lot of focus on that. Though there is much catch up going on over the last years. So good to see that those rates are rising. But yeah, if you'd like to know more about the campaign, feel free to just put your email in the chat, and I'll also put a link to our campaign page on the CDPH website. Thanks.
Thank you, Jane. Any other updates from anyone else within their organization?
Hi, everyone. This is Marlena Lopez. No updates, but I did have a question about the announcement approach training. Is that training offered in any other languages like Spanish?
Currently, it is not. And I don't know, I know that they just put out a new curriculum for 2024. So if that is on the horizon, I know it probably wouldn't be anytime soon, but I can make an inquiry with the developers team just to check to see if they have any plans to do that.
Yes, please. Thank you.
And also just noting for that announcement approach training flyer, I spent most of my time while Michael was speaking trying to get it off my Google Drive, and I was not successful. So what I'm going to do is just send it around on the email list that I normally use for, for this collaborative. So if you've registered, I'm going to send that flyer around, and then you'll be able to email me directly if you're interested in a training, or if you have any other questions on how it's set up, or anything like that. So I'll go ahead and do it that way. So apologies, I couldn't get it otherwise. Any other questions or updates from organizations?
I just wanted to add regarding Michael's presentation that, we had heard in years past from some health systems, a number of health systems had already implemented HPV vaccination starting at age 9. So where they were offering HPV vaccine, recommending HPV vaccine at age 9, age 10, earlier than 11 and 12 than we were used to hearing a number of years ago. But there were some health systems or provider offices that were really waiting to see that change made in CAIR first before they would adopt that change. So it might be worth reaching out to providers in your area just to make sure that they know that that change has been made in CAIR, because that may very well encourage them to start offering HPV vaccine. I keep saying offering, recommending HPV vaccine at ages 9 and 10. It's a good tool to leverage to and get that conversation going with providers.
All right. Any other questions or updates? I'm gonna put the link to our evaluation there in the chat. So please take a moment and let us know what you we do look at these evaluations and try our best to get to make sure that we're responding to any requests. Excuse me. And you'll see on the screen now our next date is April 17th. Hopefully it'll be warmer by that time. The next time we meet. And we're always looking for presenters as well. So if you know of someone, or if you in your health system has some best practices, or are eager to share some of the things that you've done to increase HPV vaccination, let us know. And as I said, I'm going to send out an email, and you will have my email from there, but I will also include my email in the chat there, just for any quick questions. But if there isn't any other questions or updates that anyone else has, I want to thank everybody for joining this afternoon, taking your lunchtime to learn with us. I want to thank our speaker, Michael Powell, for coming in to share that update on CAIR, and to Jane Gray for moderating the session for us. And then you'll see our website there on the screen. And we hope to see everybody in April. Thanks so much, everyone.
Thank you.